Yeah, this started based on many retrospective or observational studies that were performed over the last decade, primarily using what's known as a balloon guide catheter during endovascular thrombectomy. So, for example, placing a balloon guide catheter allows clinicians to inflate this little balloon within the internal carotid artery to cause flow arrest. At the point of removing the clot, it was hypothesized that perhaps when you have complete flow arrest, it should facilitate the retrieval of clot and also prevent any emboli, or clot embolizing distally or to new vascular territory. However, there was no randomized control trial that's ever been performed in this area. And what surprised me was that despite the overwhelming sort of trend in favor of better functional outcome using the balloon guide catheter, which causes flow arrest, approximately only half of the clinicians that perform thrombectomy use a balloon guide catheter. So that's why we went about performing this study or this randomized control trial to really compare two arms looking at flow arrest versus no flow arrest during endovascular thrombectomy, and that's what we sort of presented on. This was a multi-center randomized control trial run in the United Kingdom across 4 centers. It ran from October 2021 to June 2023. It had a sample size of 134 patients to detect a primary outcome of near complete to complete reperfusion after thrombectomy. So that's using a reperfusion score of ETQ2C to 3 at the end of the thrombectomy. And we were looking for a 25% difference ultimately between both groups. That was what the trial was powered to detect, along with a whole host of secondary outcomes. So just to summarize, we recruited and randomized 134 patients. We did not find any significant difference in the primary outcome of achieving complete reperfusion between both groups. However, even though there was a slight increase in the complete reperfusion rates in favor of balloon guide catheters, the results were not significantly different. It's possible that the trial was underpowered to detect smaller differences. So that's perhaps something that maybe trials in the future could look at. However, what we found quite interesting was that in the list of our secondary outcome measures, we did find much lower or significantly lower emboli to new territory using the balloon guide catheter or with flow arrest. We also found a significantly higher proportion of patients who had developed first-pass complete reperfusion. That is, they achieved complete reperfusion within the first attempt of clot retrieval. That again was in favor of the balloon guide catheter. And in terms of the clinical outcome based on the MRS at 90 days, the modified Rankin scale, again, although the results were not significantly different between the two groups, it was somewhat, there was an apparent trend in favor of the balloon guide catheter use with flow arrest. So again, these were sort of subtle signals that we had seen that perhaps would be quite interesting if future trials, larger trials, could perhaps look into this, if there was genuinely a benefit using flow arrest during thrombectomy. Yeah, I think they were well received. This is, like I said, the first randomized control trial that sort of looked at this specific hypothesis or question. And it still generated a lot of discussion as to whether there's perhaps genuine interest in taking this, looking into this area a little more, especially given that lots of newer devices have been placed on the market now by the different industry representatives. So, perhaps there'll be new appetite or further traction to maybe consider using the balloon guide catheter during thrombectomy. Traditionally, part of the reasons we considered reasons why half of clinicians did not use this catheter, and it was partly because the traditional balloon guide catheters that cause flow arrest were considered rather slightly stiffer, less navigable in tortuous anatomy. They were also of a smaller inner diameter, which limited the compatibility with larger aspiration catheters. And in the market now, there are observational studies have shown the larger your aspiration catheter is, the higher the chances of success. What's good to hear is that in the past year or so, lots of newer, larger balloon guide catheters have been placed on the market, which allow the compatibility with larger aspiration catheters, and they're also supposedly more navigable. So I think this could hopefully increase the adoption of using these balloon guide catheters in the community compared to what we used to have, or what the tools we used to have available to us a few years ago.